Dear viewers, Ascariasis infects 25% of the world population. However, most ascaris infections are without clinical disease. Even then, it causes clinical disease in 1.2 to 2 million cases with 20,000 deaths globally per year. The clinical manifestations are mainly related to the peculiar dance of the worm in the gut lumen and its ability to explore and enter the various body orifices. One of the favorite orifices the worm explores and enters is the ampullary orifice, situated in the second part of duodenum, causing the clinical disease entitled Hepatobiliary and pancreatic Ascariasis. The video shows a peculiar dance of the worm in the duodenum. With these dancing movements, the worm explores and enters the ampullary orifice, situated in the second part of duodenum. Kashmir Valley is highly endemic zone for ascariasis and hepatobiliary and pancreatic diseases caused by the worm or a significant health problem in the community. Here we depict the video images of a 30-year-old woman who had worm in the bile duct with significant biliary pain and cholangitis and needed worm extraction from the bile duct at ERCP. Ultrasound is a dependable tool to diagnose worms in the bile ducts. In the longitudinal views, worms look like long echogenic strips with a central anechoic tube representing the alimentary canal of the worm. In the transverse view, worms look like echogenic discs with an anechoic center. An ERCP was done in this patient because of severe intractable biliary pain and severe cholangitis. The cholangiogram revealed a long linear filling defect in the bile duct, which was caused by the worm in the duct. At ERCP, we envisaged extracting the worm from the bile duct. An endoscopic basket was introduced through the ampullary orifice into the bile duct. The worm was caught with the basket and removed from the bile duct. The 25 cm long and 6 mm thick worm extracted from the bile duct is shown. Following the worm extraction, we performed a repeat cholangiogram. We showed no filling defect, suggesting the worm had been successfully extracted from the bile duct. Following worm extraction, the patient had rapid relief of biliary pain and resolution of cholangitis. Worm extraction at ERCP is a significant therapeutic advance in hepatobiliary and pancreatic ascariasis and is essential in a subgroup of patients with intractable biliary pain, severe cholangitis, and acute pancreatitis.